Now, untreated symptoms often manifest as behavioral challenges. When a patient's reality is altered by delusions or hallucinations, their behavioral response is often a defense mechanism. So they have an altered reality, there's an emotional response because of that altered reality, and then because of that emotional response, it's followed by a behavioral response, right? So it's ABC, antecedent, behavior, and then a consequence. Okay, hidden physical health issues that can trigger or worsen symptoms and make someone hallucinate or be delusional. Hearing loss, vision loss, leads to misinterpretation of surroundings. So studies actually have shown that people who have hearing loss, just so you know as a side, have a 71% greater risk of having cognitive impairment and dementia. 71%. So a lot of us, right, hearing loss as we age, and then I don't want to put those things on, man. I don't want to have someone look at me like I'm wearing something over here. I'm not old, right? I'm okay. But what happens? You see how built I am, right? You see how many muscles I have, right? I'm a pretty built guy, right? What happens if you work out? What happens to the muscle? It grows. If you don't work out, it's atrophy, it doesn't grow. What happens in the brain if sensory information is not coming in, and you don't want to feel bad because someone's talking to you, so you're gonna you hear well, but you're gonna go like this, but nothing is coming in. And if you're not coming in, then is this guy working? And what happens if it doesn't work for 3, 4, 5, 6 years? Right? So that's why sensory is important. But if they don't hear, if they don't see well, that's also can stimulate. So check that. Infections we talked about. Dehydration. Pain. What does the baby do when it's in pain? It cries. Someone who has dementia, a person living with dementia, if they don't know how to express themselves, what are they going to do? They're going to act and behave and do behavioral things that are different. This is a huge one. Medications. Medications can cause people to hallucinate, to be delusional, right? Anytime someone's giving you a new medication, one of the biggest things is post-hospital. They give you a whole bunch of sheets, right? They give you this, and they say, here you go, these are hospital discharge paperwork. Not gonna work for me. Ma'am, I would like to see the doctor and the nurse. I'd like to sit down and go through the list of meds. Which one is new? Which one was removed? Why was it added? And what are the side effects? If you don't advocate for yourselves for that, it ain't gonna work. Right? No one. So that's important. Is everyone with me? Yes, finding this information useful? Yeah. Good. Okay.
If you enjoyed this video and got value out of it, there's a new Medicare program called the Guide Model. It's completely new, and it helps caregivers like you get resources like 24/7 support line, have someone in your home help out with mom while you're taking a break. If you want to learn about it, there's zero cost to it. Look at the website right over here and apply to see if you qualify.